Physiology of the endocrine system. The pineal gland. A tiny endocrine gland whose functions are not entirely clear. The pinealocyte cells that make up the pineal gland are known to produce and secrete the amine hormone melatonin, which is derived from serotonin. The secretion of melatonin varies according to the level of light received from the environment. When photons of light stimulate the retinas of the eye, a nerve impulse is sent to a region of the hypothalamus, which is important in regulating biological rhythms. When blood levels of melatonin fall, they promote wakefulness. In contrast, as light levels decline, such as during the evening, melatonin production increases, boosting blood levels and causing drowsiness. What should you avoid doing in the middle of your sleep cycle that would lower melatonin? The secretion of melatonin may influence the body's circadian rhythms, the dark light fluctuations that affect not only sleepiness and wakefulness, but also appetite and body temperature. Increasingly, children have higher melatonin levels than adults, which may prevent the release of gonadotropins from the anterior pituitary, thereby inhibiting the onset of puberty. Finally, an antioxidant role in melatonin is the subject of current research. Jet lag occurs when a person travels across several time zones and feels sleepy during the day or wakeful at night. Traveling across multiple time zones significantly disturbs the light-dark cycle regulated by melatonin. It can take up to several days for melatonin synthesis to adjust to the light-dark patterns in the new environment, resulting in jet lag. Some air travelers take melatonin supplements to induce sleep. Thyroid gland. A butterfly-shaped organ, the thyroid gland is located anterior to the trachea, just inferior to the larynx. The medial region, called the isthmus, is flanked by wing-shaped left and right lobes. Each of the thyroid lobes are embedded with parathyroid glands, primarily on their posterior surfaces. The tissue of the thyroid gland is composed mostly of thyroid follicles. The follicles are made up of a central cavity filled with a sticky fluid called colloid. Surrounded by a wall of epithelial follicle cells, the colloid is the center of thyroid hormone production, and that production is dependent on the hormone's essential and unique component, iodine. Regulation of thyroid hormone synthesis. The release of T3 and T4 from the thyroid gland is regulated by thyroid stimulating hormone, or TSH. Low blood levels of T3 and T4 stimulate the release of thyrotropin-releasing hormone, TRH, from the hypothalamus, which triggers secretion of TSH, or thyroid-stimulating hormone, from the anterior pituitary. In turn, TSH stimulates the thyroid gland to secrete T3 and T4. The levels of TRH, TSH, T3, and T4 are regulated by a negative feedback system, which is increasing levels of T3 and T4 decrease the production and secretion of TSH, or thyroid stimulating hormone. The thyroid hormones, T3 and T4, are often referred to as metabolic hormones because their levels influence the body's basal metabolic rate, the amount of energy used by the body at rest. The thyroid gland also secretes a hormone called calcitonin that is produced by the parafollicular cells, also called C cells, that stud the tissue between distinct follicles. Calcitonin is released in response to a rise in blood calcium levels. Parathyroid gland. The parathyroid glands are tiny, round structures usually found embedded in the posterior surface of the thyroid gland. A thick connective tissue capsule separates the glands from the thyroid tissue. Most people have 4 parathyroid glands, but occasionally there are more in tissues of the neck or chest. The function of one type of parathyroid cells, the oxyphil cells, is not clear. The primary functional cells of the parathyroid glands are the chief cells. These epithelial cells produce and secrete the parathyroid hormone, or PTH, the major hormone involved in the regulation of blood calcium levels. The adrenal glands are wedges of glandular and neurocrine tissue adhering to the top of kidneys by a fibrous capsule. The adrenal glands have a rich blood supply and experience one of the highest rates of blood flow in the body. They are served by several arteries branching off the aorta, including the suprarenal and renal arteries. Blood flows to each adrenal gland at the adrenal cortex and then drains into the adrenal medulla. Adrenal hormones are released into the circulation via the left and right suprarenal veins. The adrenal cortex, as a component of the hypothalamic pituitary adrenal, or HPA axis, secretes steroid hormones important for the regulation of the long-term stress response. Blood pressure and blood volume, nutrient uptake and storage, fluid and electrolyte balance, and inflammation. The HPA axis involves the stimulation of hormone release of adrenocorticotropic hormone, or ACTH, from the pituitary by the hypothalamus. ACTH then stimulates the adrenal cortex to produce the hormone cortisol. This pathway will be further discussed. The adrenal medulla is neuroendocrine tissue composed of postganglionic sympathetic nervous systems, or SNS, neurons. It is really an extension of the autonomic nervous system, which regulates homeostasis in the body. The sympathomedullary, or SAM pathway, involves the stimulation of the medulla by impulses from the hypothalamus via neurons from the thoracic spinal cord. The medulla is stimulated to secrete the amine hormones epinephrine and norepinephrine. One of the major functions of the adrenal gland is to respond to stress. Stress can be either physical or psychological or both. Physical stresses include exposing the body to injury, walking outside in cold and wet conditions without a coat on, or malnutrition. Psychological stresses include the perception of a physical threat, a fight with a loved one, or just a bad day at school. The body responds in different ways to short-term stress and long-term stress following a pattern known as the General Adaptation Syndrome, or GAS. Stage 1 of GAS is called the alarm reaction. It is a short-term stress, the fight or flight response, mediated by the hormones epinephrine and norepinephrine from the adrenal medulla via the SAM pathway. Their function is to prepare the body for extreme physical exertion. Once the stress is relieved, the body quickly returns to normal. The section on the adrenal medulla covers this response in more detail. If the stress is not soon relieved, the body adapts to the stress in the second stage, called the stage of resistance. If a person is starving, for example, the body may send signals to the gastrointestinal tract to maximize the absorption of nutrients from food. If the stress continues for a longer term, however, the body responds with symptoms quite different from the fight or flight response. During the stage of exhaustion, individuals may begin to suffer depression, the suppression of their immune response, severe fatigue, or even a fatal heart attack. These symptoms are mediated by the hormones of the adrenal cortex, especially cortisol, released as a result of signals from the HPA axis. Adrenal hormones also have several non-stress related functions, including the increase of blood sodium and glucose levels, which will be described in detail below.